Good evening, everyone. This is Pam and Linda with Conversations with Your Nurse Advocate. This is episode 26. And tonight, Linda's going to share a story with you. And we kind of called it, what do you do when you are caught with an unexpected healthcare challenge and you are not prepared? So we're hoping that Linda can share some information with you tonight that can help you get your affairs in order and get better prepared. So when an unexpected healthcare challenge comes your way, that you might be ready to deal with it. And not to say that we're ready to deal with them all, but there are some things that Linda's going to share with you that can at least get you better prepared. So with that being said, I'm going to turn this over to Linda. Go ahead, Linda.
Hi, good evening, everybody. I'm on the road traveling, seeing patients, so excuse the background pictures, but I wanted to share a story with you about one of the patients that I am currently caring for. The it's a very difficult scenario. The patient comes from comes from a very large family. She has quite a few children in her family, and they all have an opinion, and they all have, a right to that opinion and input. What the issue is that the patient that I'm caring for has not prepared a living will, a power of attorney for healthcare, power of attorney for financial services, or a durable power of attorney. So the patient that I'm speaking of had an issue where she had fallen and she fractured her hip. So she ended up in the care of our healthcare system on a holiday weekend with limited access to resources and with no real ability to make decisions. So within this family, there are quite a few children, and the children look to one individual for certain decisions, and that individual makes those decisions or helps with those decisions and incorporates input from everyone else. The problem comes in is that after this fracture of her hip, she needed to go to surgery. Well, surgery wanted to know, does she have a living will? If something were to happen in surgery, does she want to be resuscitated? Does she want to have blood? If she bleeds during the surgery, do you want to give her blood? Well, because she had not proactively developed the paperwork, the children started scrambling. Well, what does mom want? What would be the appropriate approach here? Would she want to be, resuscitated if for some reason during surgery there was an issue? So they were able to come to a conclusion regarding the surgery. So the individual signed her own consent. She did sign for a blood transfusion, but she did not want a whole lot for pain. So when after you have hip surgery, there is an issue of getting up and getting around and moving around and being able to get out of bed quickly after the surgery. So because of her lack of preparedness, or the family's lack of preparedness, they're kind of left with a lot of unmet decisions. One of those decisions is that her spouse's name is not on a lot of her accounts to access money. She's the only one on those accounts. In today's day and age, in order to access accounts, you have to have permission from the account holder to actually give access to another person. So these accounts are somewhat frozen unless she is able to access money, leaving the spouse unable to access dollars because there's nothing been written or documented to allow him to have access to these funds in case of an emergency. First issue. Second issue, no one knows where the actual paperwork and documents are for certain things, or even where the checkbooks are. So there is an issue in being able to access whatever funds there are to pay certain bills that were paid on a consistent basis. Again, lack of documentation, lack of proper planning, lack of paperwork. So the children and the spouse have to try to scramble to put these things together to be able to meet the needs of activities of daily living, to meet the needs of the financials that need to happen when you're managing a household. Second issue, she is going to need rehab. Where does she go for rehab? Well, that could be a problem because she is not able to really advocate for herself. So that is why I'm there. So, and because I'm advocating, I'm able to work with the family to help them meet some of those needs. But the families cannot themselves make the decision of what is appropriate because they don't know what she wants. The spouse is very, or her husband is extremely overwhelmed. And his confusion, his early stages of dementia are now being exacerbated because of the stress that he is under making these decisions in regards to her health care. So he's leaning to his children to help make those decisions. But the children are having a hard time agreeing on things of what is best for her because she has never documented that. So they're utilizing their historical past and what they feel based on their perception is appropriate to meet her needs and to meet the spouse's needs. So the spouse or her husband is vacillating from one place to another. Well, it'd be nice to have her close to home to be able to do the rehab. But is that the rehab place that's the best for her? One thing that is ultimately important, which I've explained to all the children, is that you need to do your due diligence. A lot of facilities and communities overpromise and underdeliver. So care has to be monitored. There has to be an advocate in place to be able to make sure that things are followed through on in regards to that individual's plan of care. Considering that Medicare now has very structured, rigorous standards behind rehab. So the individual needs to be a participant in their care. They have to actively participate in their care. They have to complete their therapy as requested and ordered. If they constantly refuse or are not participating, Medicare or the facility of choosing will say that they're no longer able to meet those needs because the individual is refusing and there's nothing more that they can do. So they will stop treating them under the Medicare A benefit for rehab and suggest either that the individual goes home or goes to long term care under a private pay component. Healthcare is ever evolving, it is ever changing. It is constantly coming up with new regulations and new rules for individuals to follow. It's very complex, and that is why you need an advocate to help you sort out the noise from what is the need. So, as an advocate, it's my role to be able to help this family make the right decisions or help give them the information so they can make informed decisions regarding what is right for this individual. Yes, she is going to need rehab. Yes, she's going to need rehab for anywhere from 2 months to the total of 100 days of Medicare that Medicare allows. What happens after that will be determined by the work that she does and whether she can actually meet the goals that rehab sets for her. If she cannot meet the goals, then options of care need to be looked at because she cannot safely go home and be able to navigate all the stairs within the lower level and in the upper level of her home to be able to complete her activities of daily living safely. And because
Linda,
of it, yes.
before we go on, when I'm just wondering if a lot of people realize when you talk about a private pay component. So for someone, if someone chooses to not participate in therapy and that Medicare component is gone, it's private pay. What's some ballpark figures that people are looking at that might cost them?
For long-term care right now, skilled long-term care runs anywhere from $8,500 to $10,000 a month based on the care that's needed. For assisted living, the care can run anywhere from $2,000 to $3,500 a month for assisted living. And that's all privately paid. There is nobody that is going to help pay for that. So it's and that the issue comes in is when the individual can or should participate and does not want to participate, and then these are the consequences of that lack of participation. So And I understand that as we age, it's harder and harder to achieve certain goals. It's harder to say, yes, I want to get up and I want to do this. The body's willing, the mind is willing, but the body's not just is not there. And it's understandable, especially after something as significant as a hip fracture. That's an extremely traumatic injury. It's very hard on the body, and the recovery time is very lengthy and very rigorous. But in order for an individual to go home, they have to do the work. And unfortunately, the only person can do that is the individual themselves. And families can participate by saying, with encouragement and with praise and making sure they find the right place to go. But one of the things that we have said all along in all of our episodes and all of our Facebook is you need to do your due diligence. You need to be asking the right questions because everything can look very pleasing aesthetically from paper on paper and on the outside, but when you get in there, the staffing ratios are not right. The PT to nurse ratios are not correct. Their star rating is poor. Their reviews are poor. The dining is poor. When you're living in a facility for 2 and 3 months for rehab, you want to be able to eat decent food. So that food needs to taste good. So you need to make sure that not only are you asking about, the staffing ratios, but what is your dining like? Who is the doctor? Who's the medical director that oversees this facility? Who will be seeing my mother because her primary care physician, or their, will not be available to be seeing them in these communities. It is usually a hospitalist. So asking them the questions of who's going to be there for mom, who's going to be there for dad, who will see them, who will write the orders. If they have an infection, how do they see the doctor? How will they be followed up on? So these are questions that they need to ask. Look at their latest survey. What does that survey tell you about the care that they provide? What does the staffing ratio look like? But the best way to tell whether a facility will provide the best care for the individual is going there, touring there, smelling it, looking at it, seeing how people interact with each other, looking at how the staff participate. Is the staff professionally dressed? Are they relating to the residents in a very, friendly, professional way? Is the staff, engaging with the resident? Are the residents engaging with each other? What are the activities? What does the calendar look like for activities? What does their rehab potential look like? What is the plan? How do I communicate with them? How will they communicate with me? All of those things are really important. What is the pharmacy that they use? How are the meds going to be distributed to my parent? What will that look like? Will it be through a bubble pack? Will it be through a nurse? Will it be through a med tech? Who is going to be doing these things? Because those things are important. Is there someone there to provide emotional and spiritual report, you know, uh, rapport with them? Will someone be there to help them with their spiritual needs? What types of masses do they have? What types of spiritual care do they provide? Do they have a chaplain on site? Do they have a social worker on site? Those things, because it's not just the physical needs of that individual for the time that they're in rehab, but it's the emotional, it's the psyche, it's that overall person-centered care that has to be employed in order for them to achieve their goals. Because if we just provide the physical and not the emotional and not the spiritual, they don't do well because they're a bigger person than just their physical needs. So I wanted to share that story because it's a lot of what we see in a lot of the patients that Pam and I take on as at when we advocate for them is because we see that individuals and families are not prepared for these emergencies. Oh, we'll do it tomorrow. Oh, it's not going to happen. Oh, we'll take care of it later. Well, later is now. And the problem is you don't want to scramble at the last minute or after something happens trying to figure out how you're going to pay for these things. What's the insurance look like? What type of care do I have? Do I have a long-term care policy that will cover some of these things? What are my options for care? What are my options for treatment? What does my parent or loved one or individual want? What is important to them? How will they be successful on this journey that they have to take? What are their needs? And are we able to meet those needs? And are the facilities that we're choosing able to meet those needs? A lot of people assume that because a facility may have 4 and 5 stars, they may be the best. But those 4 and 5 stars were from a year ago. Where are they now? That is why it's important to tour them, because you really do need to see where they're at now. What is their staffing ratio now? What is their patient nurse ratio now? What is their home health aide or CNA ratio now? So those are the questions you need to ask as you begin this journey with your loved one or a significant other. And these are the things that both Pam and I can help with, you know, as we've got 80 years of experience doing this. This is our wheelhouse. So you need to ask us, and we'll guide you, and we'll provide you with the recommendations so that you can make these informed decisions.
Linda, one question I have. So one of the
Sure.
things that we talked about in this particular case is the scenario where if rehab does not work and we're looking at, custodial care in a nursing home, what other legal documents like a trust, what other things could have been done that might have been able to preserve some of their wealth, and what may happen if this patient has to go to long-term care?
Well, yeah, that's a good question, because as we talked about this before, having your home and your assets in a trust with designated authority for someone to be able to work within a trust, having a durable power of attorney for healthcare and finances, or having them separately so that an individual knows and has access and has their name on the accounts to be able to access the monies in regards to maintaining a household or maintaining the bills that may come up due to the health status of the individual. So putting your home in trust, although the government now says that trust has to be initiated 5 years before any type of incident or being able to not claim it as an asset. So there is a lot of, you need to contact an elder attorney or an estate planning attorney to be able to walk you through those, to be able to develop or set up a trust for your assets. Having someone as a secondary or authorized signator on the accounts is also really important. If your name is the only one on that account, nobody else is going to be able to have access to your money no matter what you say, and things that you need to have done, such as bills being paid and electric and telephone and pharmacy bills and all of those medical bills that need to be paid. They're not going to have access to that because they can't get onto your account. And in today's day and age, with all the identity theft, a lot of those things have to be done in person, and documents have to be signed in person and or be notarized in front of a bank officer. So these things are not things to just can happen. You can't just call someone and say, I need to have access to so and so's account. She's my wife. If I bring in my driver's license and I bring in hers, can I have access? That doesn't happen today. There's a lot of, double check systems in place because of everything that has happened within our society with identity theft and, vulnerability and fragility of the elderly being ripped off. So these things just don't happen. There are processes that you have to go through. So being proactive by having secondary signatures on checking accounts, saving account, money market accounts, CDs, knowing where the stocks are, knowing what's in the portfolio, having an updated will and updating your will on a continual basis, like every couple years, will keep things in order, making sure that your families have copies of your healthcare power of attorney, that your physician has a copy of your healthcare power of attorney, that your family has copies of your will and who is the executor of your estate. It sounds like a lot of, oh my gosh, this is so overwhelming, but if it's done in pieces over a period of time, when bad things happen, everyone is prepared, including your loved ones. They don't have to go searching. They don't have to fight amongst themselves. They don't have to argue because your plans are very clearly delineated in what you want and when you want it and how you want it.
So, Linda, bottom line in this situation, Is it possible for them to lose their home?
It could be. They could lose their home. They could lose their home because if they don't have it in trust and they occur a lot of debt and nobody can access the account and something happens to her, they may lose their home, to pay off all these bills.
So that would be such, and that's the struggle is that, you know, all of us work so hard for so many years to try and get by and put away a little nest egg and to have it only to risk losing it all if we skip that step of being financially prepared for those health challenges or that may come up. And so it's really, whether it's 5 years in a trust, it used to be 7 years in a trust, it's well worth taking the time to get that done now, because you know then when you get to this situation, it's too late. I mean, it really, really is too late.
Right. And
And
the thing is, if you don't have the resources to pay the bills, and if you're looking at being eligible for Medicaid, they look at that. They look at your house as an asset. You can live in your house, but, that doesn't guarantee you that when you sell that house after a spouse or someone dies, that Medicaid isn't going to come after you for whatever they paid out under Medicaid. So there's a lot of different changes that happen, and they change quickly. And being prepared and seeking the professional advice of an estate planning attorney will really help, alleviate a lot of stress and frustration on the family's part in knowing what is needed at a specific time in regards to the overall care of the individual when there's an emergency or something bad really happens and they can no longer be their own advocate. And part of the
yeah,
problem is when you don't have a healthcare advocate and the individual goes into the emergency room and families don't agree on the plan of care or the treatment, social work says, well, you know what, then we may just have to take guardianship if you guys can't agree with what's going on with how the care should be handled.
yeah,
So,
and then that's a shame. And you have a family of people that all care and love someone, but if the wishes aren't written down so that's clear to everyone what the person wants, then everybody's fighting over what they think is best. And what a shame that would be to have their loved one turned over to a public guardian because the family can't get it together
right.
and come to an agreement on how their loved one should be managed with their healthcare needs. So it
Yes.
just can be a complete disaster.
Yes, it really can be. And it can tear families apart because nobody really knows, what the individual wants. And it's just a simple document that says, this is what I want. I don't want this. I want this. This is who I want as the executor. This is who I want to take care of my health care. This is who I want to take care of my finances. This is how you access my accounts. This is the authorized signature on my accounts. These are the things I have in place in case something happens to me.
And just to let everyone know, one of the things in within the next week or two, we did have Nadine. We had a social worker on recently, but in the next week or two, I'm in the process of scheduling a hospital social worker that's going to talk specifically on advanced directives and how to get those prepared and what you can, what's available and how to go about that. So we look forward to that. This has just been a real challenging client to deal with. So we just wanted to share that with you. Linda, any closing thoughts that you'd like to say?
Families, when they have 7+ children, you know that this is so important, whether you have one child or seven, and this family happens to be very big. Lots of input. Everybody's a professional, so there's lots of knowledge input, but not necessarily in healthcare. But they're going from the perceptions of what they feel is important based on what this individual wanted in a when they were younger, and based on what they feel is important for this individual, not necessarily what this individual needs at this point in time. And that's the struggle. And that's a huge struggle. And, outcomes may not be good because of it. So, you know, all I can say is plan, plan, plan. Failure to plan can only end up in a crisis.
And so that sounds like a great place to end, although it's not a happy
Not a
ending.
happy one, but no, yes.
So thank you everyone for joining us tonight. And we just want to thank everyone that's going to catch us on the replay after this has been recorded. It'll be up on the Facebook page. And then we will see you next week, same time, same station. And we will get out who will our guest speaker will be next week. So everyone have a great night and take care.
Thanks. Bye-bye.
Right, bye-bye.